All right, I would like to welcome everybody on board. I'm so glad to have you all here. And I also want to thank you all for sparing your time, despite your busy schedule, to join us in tonight's meeting. My name is Chukwu Marydith Ifeoma. I'm a young pharmacist based in Enugu State, and I will be the moderator for tonight's meeting. I would like to recognize the presence of all the coordinators of this group, which is ably led by Pharm Okechi Nzedibe, FPSN, and lecturers in various universities, fellows of Pharmaceutical Society of Nigeria, fellows of West African Postgraduate College of Pharmacists, our senior colleagues, and distinguished participants. Our presenter for tonight's meeting is Pharm Okechi Nzedibe, who is the CEO of Histripes Pharmacy, which is located at Akwa-Ibom State. She'll be presenting with Pharm Itoro Obong, who is a pharmacist at the University of Uyo Teaching Hospital. She'll be presenting on the topic journal clubs, and the presentation will last for about 30 minutes, after which there will be questions and answers, as well as contributions and comments from the participants. So, Pharm Nzedibe, the floor is open for you to start, ma'am.
All right, so our topic is journal clubs, and I would like to express my thanks to my team members who have worked so hard to make sure that this manuscript is produced. Next slide, please. Okay, we will be looking at the objectives for floating or holding journal clubs. And then the objectives are basically describing the process of developing a journal club presentation, like we've been doing. What we've been doing, we've been presenting journals in on all the meetings we've been having, then discussing the benefits of journal club participation, applying the concepts of literature evaluation to a journal club presentation, then describing effective strategies to increase interest and participation in journal clubs, then also describing the methods needed to add clinical relevance to journal club presentation. So it's not just about journal club, but whatever is going to be discussed in a journal club must suit the interests and expectations of those who are in the meeting. Next slide, please. So what do we actually call journal clubs? Definition of journal clubs. They are groups of individuals who meet on a regular basis to discuss and critically evaluate biomedical literature. And generally, healthcare professionals are holding a whole lot of those meetings. It's much more common amongst healthcare professionals. And there's no standard method. It's supposed to be flexible. In essence, meeting with the needs of the audience you have at a particular point in time. Next slide, please. The objectives We have already done that. Okay, yes. Process of developing a journal club. So seeing that the journal club is meant to explore the learning objectives of the journals we'll be discussing every time. First of all, you identify a leader to organize the journal club project, just like we've been doing in this drug information group. Identify the goals of the journal club. For example, if you're going to discuss a clinical problem, it's an interest area in those who you want to be your audience, you have to get a group of experienced clinicians who aim to know more about that clinical problem. Then a convenient and meeting place must be kept. Then ideas of research articles around that same interest area will be used. Then the journal club will now be held. At the end of it, the meeting will be evaluated to find out if the meeting was able to meet with the expectations. Then the benefits of journal club participation. It improves understanding of statistical methods and research design, because this is a very key point in research. You can't leave talking about statistical methods and research design. Then it fosters the development of evidence-based practice, which is prevalent now in medical field, evidence-based practice everywhere now. Then teaching and development of critical appraisal skills, which is we are very conversant with all of that, those of us who are into research. It is also used in practice to answer clinical questions. So helps presenters hone their public speaking and meeting facilitation skills, like many of us have been and facilitating all this while. Okay, then it increases exposure to rapidly evolving medical literature, because a whole lot is happening now, and education, learning is evolving every day. Next slide. Okay, what are the expectations of participants, assuming you have to float a journal club? One, a facilitator will have to be provided. The person has to be named who will be responsible for the logistics. I know that since we've been holding our meetings on this platform, some people have been at the helm of affairs, responsible for the logistics of the journal club, designating the presenter for each session, inviting the participants as we've been invited today, securing the meeting space, which we have on Zoom right now, communicating the logistics of the journal club to all the participants in an organized manner. Then the presenter will be there, responsible for providing an overview of the selected article like I'm doing now, and engaging other participants also in the meeting. Then, very important, a content expert, like we are talking about journal clubs now. I'm sure that there are people on this platform today who are very conversant on how to hold journal clubs, probably been doing it online, doing it in your place of work, doing it amongst your friends, amongst your colleagues. So a content expert helps to provide practical insights into how the intervention being discussed applies to real practice. Next slide, please. Okay, so conducting a journal club, having talked about the people, the resources that we needed to anchor the different parts of the presentations. Now, conducting the journal club. In establishing clinical relevance in journal clubs. Okay, let me take it again. The journal club helps to establish clinical relevance in researches that pertain to clinical practice. Then the aim of conducting the journal club, apart from the one highlighted before, the things we have talked about before, is areas that are around research, utilization, improving patient outcome. At the end of the day, there must be a result we are looking at. There must be an outcome we are all looking forward to. So in essence, the journal club, the choice of the topic, the choice of the people that will be brought to be a part and parcel of it, especially even the content expert, will have to revolve around the relevance of what we are going to be discussing. It has well been advocated as a bridge between research and practice. Let's go to the next slide. Okay, modern method of conducting a journal club includes use of online media, like we're using now. And then we have models that could be adopted. The adult learning model, the problem-based model, you have the experimental design format, then you have the debate form. Those things we can expatiate maybe later on. Next slide, please. Okay, journal club setting. There are different settings. It can take place in many settings. Like we have the classroom setting where you have students who could be presenting a journal or a literature to a group of people. Then we have informal settings such as in a home or in a public place. That one, it needs to be a very comfortable place for people to relax and listen to what is being talked about. Then we have the office setting. It depends on what is convenient for those who are involved. Next slide, please. Okay, ways and strategy to increase the participation of people in journal clubs. Okay, we have to introduce critical review papers and incorporate learning principles that agree with the goals. In essence, the choice of the papers that were reviewed will have to achieve goals that are relevant to the expectation of the participants. And we have to ensure effectiveness by appointing one facilitator. Then, of course, provision of refreshment is also advised so that the participants will be willing to come as probably as often as possible if it's a face-to-face meeting anyway. But for us who are online, we cannot see any cook flying from one pot to the other. So promoting evidence-based practice, like we've said already, and teaching critical appraisal skills as well. Next slide, please. Okay, journal club format. We've talked a little about them. There are several journal club formats that can be used. Presentation-based journal club. The presenter will present an overview of a study along with their critique. And the adult model follows this particular system as well. Let's go to the next one. We might not go through all of these bullets for now. Next slide. Then the discussion-based journal club is a more prevalent style of a journal club outside of the classroom setting. In this format, all our attendees are expected to have read and critiqued the selected article, just like we have. This article has been posted many weeks back. So it's expected that attendees may have read and critiqued the article for discussion. So this format of journal club is used to evaluate current literature and emerging therapies. Next slide. Okay, then we have the online journal clubs. This format is particularly attractive for multi-site health systems, especially where people cannot come together. They can just log on online and they're able to attend. Like we have some people from different states. Marydith is joining from Enugu, and I know some of us are from different states of this country. Then using video conferencing software. In this format, the journal club may also serve as a purpose of socialization socializing, and professional networking by increasing communication among practitioners. Essentially what we're doing, we're pharmacists here sharing ideas on this platform. Okay, next slide, please. Applying concept of literature evaluation to a journal club. We have been talking about literature, and so you can't separate it from talking about literature review. So the literature review is a summary of studies related to a particular area of research and identifies, summarizes all the relevant research conducted on a particular topic. So now literature evaluation will have to involve you reviewing the literature. So evaluating past research, like we've said, identifying experts. It's necessary to identify credible researchers who have done, notable researchers that have done a research in a particular field. And then, of course, taking them from sites, notable sites like PubMed, that you have them peer review articles that you have very reliable information from. Let's go to the next slide. Okay, now it will involve identifying the key question, collecting resources that will help you determine those questions. It's actually expected that before a literature review or a journal club is conducted, questions could be received from the participants, and that will lead to the expectation. And that expectation would also lead to the kind of articles that will be searched out for and used eventually for discussion. Then determining methodologies used in the past studies, knowing how others approached a particular topic is also important to give opportunity to identify and find new ways to research and study on the topic. If there is further research or further findings that could be done on it, it can be done, or even suggestions and suggestions on how the methodologies could be improved. Some mails could be written and sent to those who published it, and that could add to knowledge as well. Let's go to the next slide. Okay, applying the concept. Okay, that's continued. Let's go to the next slide. I think we talked with some of this too. Okay, preparing the presentation. Journal club session may consist of a presenter, we've talked about it, introducing the in a structured way. It can be helpful to check a list of reading guide, like from the McMaster Reading Guild or JAMA papers. Those, okay, then the advantage of this approach is that reviews are more consistent and the readers are able to identify methodological flaws, like I said, and they could write on it and tell the publishers about that. Journal clubs also have been used as a forum to discuss educational intervention. Next slide, please. So when you're selecting your article, choose a recently published article with focus on problems commonly encountered. Those are the things that will catch people's attention. And recurring discussions online, recurring discussions on educational sites will give a guide on the articles that will be of interest to a wider audience than getting something that people might not be too interested to talk about. Giving priority to original article, getting the article originally published on that particular topic will also help. Then selecting article with good impact factor. That's what we've been talking about, something that people will want to talk about. And at the end of the day, when the discussions has ended, it will have a good impact on the people who have listened, and then also to be able to answer the questions they are all asking. Okay, let's go to the next slide. Okay, presenting a journal. However, in presenting a journal, the following points must be taken into consideration. The clinical question that leads to the literature research and the reason for choosing the particular article. We've touched on it already. The author, the title of the article, outstanding features, impact factor, we've talked about it already. The hypothesis, the PICOT format that was used in the journal also will need to be noted. Having an audience-based assessment of the journal article. Okay, we've talked about it a little. Two types of study can be descriptive, cross-sectional, case control. Any of these studies used in it is still acceptable. Any of the studies done with these types of studies are welcome for discussion. Next slide. Okay, it's still part of it. Okay, journals, looking at the meta-analysis, systematic reviews, this must have a focus on study population, then randomization, inclusion, and well, these are components of journals, and being able to present, get a good journal, you must be able to see a whole lot of these analysis on it, the meta-analysis. Then some of them, if they're systematic reviews, and then the randomization, inclusion, exclusion criteria, those are things that make a good journal. Analyzing methodology, this must involve diligences, consistencies, follow-up, appropriate outcome measures. Well, this should give us an idea of the kind of journal we should present. The result of the journal value must be clearly stated and must be statistically, okay, I can't see what is written at the other end. Then discussion and interpretation. Well, a good journal will have all of this, so that should give us a guide on what to look for and what to present for discussion. Let's go to the next slide. Okay, in conclusion, in running a journal club, you must always have 5 things in mind. So having said all that we have said today, to highlight new things, there must be something new that we have to learn from it. To teach practitioners how to select interesting articles representing the evidence for clinical practice. To encourage reading and learning of critical appraisal skills. To encourage applied clinical research and improving in leadership and peer mentorship. Thank you very much, and thank you for listening. At this point, I'll hand over to the moderator for the rest of the meeting. Thank you.
Thank you so much, Pharm Nzedibe, for the wonderful presentation. Please, if you have any question, you can ask. Hello.
Yes, we are hearing you. We are with you. The floor is open for comments, contributions, and questions from the participants. Maybe in my own little comment, I want to add that during our family training program at Uniben, Journal Club was an assignment given to us. I discovered that many people were not aware of what it takes. They were given assignments, they don't know what to do. And even in some schools, in some university, at the final year level, they used to have, put their students through journal club. But most of the cases, most of us, they don't know what to do. So I want to recommend this module, very short, to everybody. Let us go back and study it very closely. It's going to be very impactful to our practice. That's my only little contribution. Thank you.
Thank you so much, Fambelo, for the wonderful contribution. We'll go back and look into the article again. Please, the floor is open for any comment, contribution, or question.
No, the lecture was so clear and was also loud and straight to the point. I want to take it that people understood, so we don't need to waste more of our time. And the speaker, I want to really appreciate you for that wonderful job. So
All right, so in the absence of no question, I would like to invite our cheerleader, Pharm Folasade Olawal, to give us a closing remark.
Thank you very much. It's been another great time out, and a lot has been learned. I believe that all of these learnings will improve our practice. We are very grateful to our resource persons. We are very grateful to all who have contributed one way or the other to the success of today's program. Thank you all, and God bless you.